Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone. Welcome to today's professional. And today we're going to be talking with Dr. Wesley Shankland, of course, from Lima Dental Associates. And there's a pet peeve about that people have you want to talk about.
Yeah, medical histories. Before we went on air, you were laughing about it. You said, good God, I got to fill out and fill out and fill out forms. And that's true. How many, we always walk into the doctor's office, doesn't matter what kind. It could be your vet, it could be your dentist, your physician, chiropractor, doesn't matter. And the secretary greets you and hands you a clipboard with about 3 or 4 or 6 pages to fill out. Yeah. Please come on time. Please come early for your appointment for that. But we have to fill it out. But you don't realize how important that is to all of us. Right. You know, the first section is usually not just your biographical data, but also have you had diabetes? Have you had cancer? Have you had this, heart or prosthetic joints? And we need to know those things, George, for lots of reasons. We need to know how to prescribe medications. You know, we don't want to prescribe an anti-inflammatory for somebody who's on hypertensive medications or somebody who's got an ulcer. We don't want to do certain procedures on somebody who's had a joint implant or a prosthetic joint without pre-medicating them. But we don't want to do certain other things without knowing their history. So we're not trying to give you a hard time, because I have to do these things too. So we need to know your history. What have you had? What diseases, disorders, surgeries you've had?
Well, you have to read them so you know how to.
Well, I go over all of them and in depth. Then I go over them with the patient. Yeah. Then we have to know, have you been hospitalized recently? And if you have, for what reason? Again, not because we're nosy, it's because we want to know what kind of medical history you have so we know how to appropriately treat you. Mm-hmm. We need to know what kind of medications you're taking at this point so we don't give you medication to counteract those or interfere with those. We need to know what allergies you might have, or we don't give you something that's wrong, you know, or something like that. So we need to know that. Then we have to have an area where we know how to contact family in case there's an emergency in the office. Now, thank the Lord, I've only had a couple emergencies in over 30 years, but I needed to know who to contact. I needed to know who the physician was to contact, and family who to contact, and that also gives us HIPAA permission to contact other people to talk to about the patient. So medical histories are very important.
Especially who else to contact, obviously.
Absolutely. Yeah. So who to call and what's the number and how to get a hold of people. Okay. Very important.
Thank you, Wes. Anything else?
Keep smiling, sharing, and George, you keep caring.